In this video, we will watch an example of a face-to-face meeting between a pharmacist and a prescriber, in which the pharmacist utilizes an infographic as a conversation starter to discuss mutual patients and care opportunities. You will see how using patient data can be used in a unique way to initiate a conversation that could potentially spark ideas leading to further pharmacist-prescriber collaboration. Keep in mind that this is an initial conversation between pharmacist and prescriber. You are laying the groundwork for a process of relationship building that will take place over time. This is not a one-and-done meeting. This is an icebreaker. If the prescriber listens to what you have to say and seems receptive to it, that is a win. Now they know who you are, and you can prove you can be of help over time, and mutual interests of both parties can be advanced. The very first step, once you have your data gathered and formatted in an infographic, is to reach out to the prescriber's office. You will likely get a hold of the office manager or other office assistant on the phone. Your request should lead with the fact that you have patient data to share. It might sound something like this.
Hi, my name is Jody Pantone, and I'm a pharmacist at Smith's Pharmacy. I have data on Dr. Stone's patients who come to our pharmacy, and I wanted to get his feedback regarding that information. I'd like to set up a time to meet with him at your office at his earliest convenience. Is there any upcoming time that works for him?
Once you have the visit scheduled, let's take a look at how it might go.
Sorry I'm late.
No problem.
Wrapping up with a patient. I'm Jeff Stone.
Jody Pantone. Nice to meet you.
Nice to meet you.
I'm from Smith's Pharmacy down the street. I spoke with your office manager, Kim. I'm not sure if she told you about what our meeting was about today, but we've been looking at some data coming from our pharmacy, and I want to share that back with you to get some feedback on what your thoughts were.
Sounds great.
To start, introduce yourself and explain the reason for the visit. Explain that you are looking to enhance the care of patients at your pharmacy and would like to get their feedback. Notice we are not starting the conversation with a listing of the pharmacy's services. This is not a sales pitch, which is not always the most effective way to initiate collaborative conversations. As we all know, physicians are short on time. Make sure to keep your visit brief and know the main points you want to cover ahead of time.
Thanks so much for taking the time to meet with me today. I'll try to be very brief because I know you're probably busy, but we are working on some things at our pharmacy where we're looking at the data that's available to us, which comes from the prescriptions that we dispense. So we're looking at data from patients who go to your practice and then also come to our pharmacy. And I want to share that today with you to get some feedback on that, if that sounds okay to you.
Yeah, sounds good.
Great.
Be sure to explain what the infographic is showing and where the data came from. Do this before handing the prescriber the infographic. This way, you provide the context needed to digest the information. Talk about mutual patients when you can. For example, not your patients or my patients, but instead our patients. This creates a feeling of ownership for the both of you. And lastly, utilizing principles of motivational interviewing, ask the prescriber permission to share your thoughts with them, and tell them you'll want to know what they think of the information when you're done.
So before I show you this data, I wanted to ask you a few questions about your practice. So could you tell me a little bit about the types of patients that you see and maybe some information about what their medication-related needs are? So adherence, polypharmacy, things like that.
Sure. So my patients are mostly elderly, so complex patients. But we are a family practice, so there's a wider range of patients too. For my patients, primary issues are things like transportation, costs of medication, especially for the ones that are in the donut hole, and polypharmacy, of course, is an issue. Sometimes I'll get a list from a patient, a med list from a patient, and I'm just like, how did you get on all of these? So those are some of the issues we see.
Okay.
Notice the pharmacist began the conversation by first asking the prescriber about their patient population and inquiring about what medication-related needs the prescriber typically sees in practice. To be an effective collaborative partner, showing your willingness to listen can have a clear impact. You should not be doing the majority of the talking. Listen to the prescriber's needs and wants.
So this is an infographic of data that we're able to readily capture at our pharmacy. So this is the prescription information from patients who chose to both see you as a prescriber and come to our pharmacy to get their prescriptions filled. So this information is from a 6-month period of time between July and December of this year. And you can see that there were 66 patients who chose you and come to our pharmacy.
I'm surprised it was that many.
Yeah, we were surprised too when we looked at this data. So in order to walk you through this, I'm just going to go box by box with the information here. So this first box shows the chronic disease state prevalence among the 66 patients who come to our pharmacy. Of course, we had to infer that information based upon the prescriptions that patients fill, but you can see the number of patients out of these 66 who have hypertension, depression, anxiety, diabetes, etc. So I'm just wondering if there was anything surprising to you on this block.
Well, I am surprised that diabetes isn't higher. I feel like we have a lot of patients with diabetes, but depression and anxiety, we do have a lot of mental health issues in our patients. So that's about it. It's very interesting though.
Yeah.
Be sure to walk the prescriber through sections of the infographic and explain where the data came from. Do not appear judgmental or like you are praising or blaming the prescriber for performance. Let the data speak for itself.
So I am surprised that diabetes isn't higher. I feel like we have a lot of patients with diabetes, but depression, anxiety, we do have a lot of patients with mental health issues, so it makes sense.
And again, this is something to keep in mind. This is a snapshot of information, so it's possible that more of your diabetes patients choose to go to other pharmacies or use mail order pharmacy, and that's why the number appears lower than what you would suspect.
The prescriber may express surprise or comment that they think some of the data is an inaccurate reflection of their practice or prescribing patterns. That is okay. There are limitations to what the data captures, but it still does tell a story, and you are representing medication fills within a certain time frame from that prescriber at your pharmacy. Also, be aware that many practices have multiple prescribers. If you have made an infographic tailored to one prescriber, this does tell a very valuable story, but it may only be a piece of the story. It may be helpful to also create a whole practice infographic with aggregate data from all providers, if you know that the providers frequently cover each other's patients.
So it's really interesting to me that you mentioned diabetes, because in this box we actually took a look at diabetes quality measures. So you can see here that 4 out of 10 of the patients with diabetes were taking a statin, and 6 out of the 10 patients with diabetes were either on an ACE inhibitor or an ARB. So knowing that information, I'm curious to know what other questions you have or what other information you would want to know about.
Yeah, I mean, it's interesting to me that not more of my patients are taking statins, but that could be because, like you said before, they might not be going to the same pharmacy. They might be going to other pharmacies. I know also we have some patients with angioedema, so that could be why they're not on an ACE inhibitor.
That makes sense.
But those patients, I think I'd like to learn a little bit more about and see what's going on there.
Yeah.
Again, ensure that it does not seem you are judging or putting down the prescriber's performance or care of their patients. If someone feels threatened, they are unlikely to listen to anything you have to say. It is important to do your homework before approaching a prescriber. This pharmacist took the time to look into the practice before the meeting. She looked at the data she had available from the pharmacy to gain an understanding of what kind of patients the providers in the practice see and what the structure of the practice looks like. Starting with a patient population level infographic stimulates conversation without getting bogged down in patient-specific issues. Once you cover the infographic, the prescriber may likely express an interest in knowing which patients are behind the numbers. This would be an excellent opportunity to discuss a follow-up meeting where you can provide patient-specific details.
So in terms of quality, I'm trying to learn a little bit more. So we pulled out a few of these quality measures that health plans are measured upon, but I wanted to learn, hopefully from you, a little bit more about what physicians are measured on in terms of quality.
Well, I know we're working currently on getting our colonoscopy and mammogram screenings up.
Okay. And are there any other quality measures that are related to medications?
Well, statins and diabetes, obviously. Also, cardiovascular disease, and I know we are trying to improve adherence among our Medicare population as well.
So it's interesting to me that you mentioned medication adherence, because that was actually one of the data points we looked at as well. So in this box, you can see adherence to specifically antihypertensive medications. And this shows that 75% of patients on those medicines are adherent to their medications. So I was wondering how frequently maybe you encounter patients who are not adherent to their medications.
Yeah, I mean, we know it's an issue, but we never really know the extent of it. I have a couple patients who I know it's always an issue, but you know, for other ones, it's not that easy to tell. We just have to kind of assume that when we give them a prescription, they go, they fill it, and then they take it as directed, but we don't really know for sure.
Yeah, I can see how that would be, potentially challenging for you. And we obviously get that at the pharmacy as well, which is why we've implemented a few services to try and help combat that issue of medication adherence. And one of those is called medication synchronization. I don't know if you're familiar with that at all.
No, I don't think so.
Okay. Would you mind if I tell you a little bit more about it?
Go ahead.
Okay.
Before your visit, have a good baseline understanding of how physicians and prescribers are assessed with quality measures and how that affects their payment. Asking for more information is a great way to show interest as well. Ask about what quality measures or initiatives the prescriber is focusing on right now. Focus on quality measures related to medications. You can then transition the conversation into how your pharmacy can help address those needs.
So if I notice a patient is having trouble taking their medications or being non-adherent, is that something that you would want to know as the physician?
Oh yeah, it'd be great if you could let us know about that. When patients are refilling early, or if they're not filling at all, that's something that we really need to know about.
And how would you like that information communicated back to you?
You could call us or fax us. We get a lot of faxes from you.
Make sure to tailor the conversation based on what you learned about the mutual patient's medication-related needs. Near the end of your conversation, make the transition to talking about services your pharmacy offers. Your services should not be the focus of the conversation, especially the first conversation you have with the prescriber. Remember, this is not a sales pitch, but a conversation about mutual patients. After you listen to what the prescriber's concerns are, you can appropriately match a service or two to their needs. Always ask how communication between parties should occur. This again helps build a relationship by bringing the prescriber into the decision process and taking their preferences into account. You may see communication start to be more effective now that the prescriber is expecting it from you.
Yeah, that would be great. Unfortunately, though, I gotta get back in a minute.
Sure, that's absolutely no problem. I can wrap up pretty quickly. I just wanted to see if there were any last questions that you had about the data or this infographic in general.
Not at this time, no.
Okay.
You've been really helpful.
Great, good, that's good to hear. And I also have some printed information about some of our other services at our pharmacy, including free delivery. And then this is my business card that you can reach me at.
Delivery, I didn't know that you did that. That's great.
Yeah, we actually deliver within a 15-mile radius. It's really popular with our patients.
Wow, yeah, I'll have to take advantage of that. And here's my card, too.
Great. All right, it was so nice to meet you,
Yes.
Dr. Stone.
Very nice meeting you.
Thank you.
Always exchange contact information And if you have more detailed printed information on your pharmacy services, leave those with the prescriber as well. Follow up on prescriber requests and check back in about 3 weeks to see how your actions have been accepted. Now that you've seen an example of an initial pharmacist prescriber face-to-face meeting, remember these final points. Center the conversation on patient needs. Always remember, it's about the patients. Actively listen. The prescriber should be doing the majority of the talking. Present data in an objective, non-judgmental way. Save talking about pharmacy services until the end of the conversation, once you determine the specific needs of the patient population and the prescriber. Do the little things. Following up on requests builds trust, which is key when building a relationship. Something that seems small can open the door for future opportunities to work together. Write down any physician requests either during the meeting or right when you get back to your pharmacy. And always thank the prescriber for their time. Thank you for watching. I hope you found this video useful, and good luck.